With AFib, I guess that's when I talk to people, they talk about AFib as kind of the one that's the most difficult to live with. It's the most difficult maybe to be treated.
Right.
But there are new medications that are out there now.
There are new medications. We have new blood thinners. So the big risk of atrial fibrillation, and the one we're trying to prevent, is it causes stroke, and it's the one cause of stroke that's preventable if you treat the patient with blood thinners.
Right.
So it's a big part of what we're trying to do. We're trying to find those patients and at least get rid of that risk. In addition to that, it's the symptoms of the disease itself, the sudden palpitations. That we have some drugs. Our drugs have not been traditionally good for that. Then they have a lot of side effects, and in some instances they're risky. Right. So in fact, a lot of times I would think that an atrial fib ablation in a younger person is much less risky than giving that patient some of these drugs for the next 10 or 15 or 20 years, and a much better success rate. So we have things we can do with ablation, but the recurrences rates are high, and the patients who come with a late stage AFib, much more difficult to treat. And nobody, there's a lot of different theories. I don't think it's a disease that we'll ever be able to totally fix. The symptoms we're going to be able to placate and treat the symptoms well. We might be able to slow the progression of the disease, like you said,
right,
by preventing. This is true for every kind of degenerative disease. We're finding out now, for cardiac disease in general, that if you, the more bad episodes you have, it tends to cause progression of the disease. So the more AFib episodes you have in a month, it's more likely that a year from now you'll have permanent AFib. The more episodes of congestive heart failure you'll have in a year, the same thing. You might end up on a transplant list sooner, or you might you might not survive for 5 years. So those kind of degenerative diseases, we used to think that the only reason to treat is to prevent the symptoms, but the truth is that by preventing these acute exacerbations, we're actually preventing progression of the disease.
Wow.
More importantly, even.
Well, I got to tell you, fascinating topic, and I know you're very busy, and I don't want to take up a lot more of your time, but I've got a question for you. When 5 or 6 years ago, there was a gentleman that I was talking with, and he had some heart issues, and his doctor said, maybe you should think about doing some walking or some exercise, and we were just talking as friends. And I said, well, what are you going to do about that? And he said, well, I believe that you only have so many heartbeats in a lifetime.
Yeah, I heard this before.
And if I get out there and use them all up by accelerating my heart, I'm not going to have as many, so I'm not too worried about exercise. What's your thought about that?
Well, if you train your heart, you bring down your resting heart rate.
That's right. So
exercising for 30 minutes and getting your heart rate up, if you change your resting heart rate from 80 or 90 beats per minute to 60, that makes all the difference in the world.
It's just a math problem.
It's just a math problem. But even if you believe in that,
yes, if
you train your heart and you reduce your resting heart rate, then you've made yourself, you're going to be able to last longer, right? So that's what I answer to that. And there is an obvious training effect, and we can all achieve it. We can all drop our resting heart rate easily by 10 beats a minute, 10 beats, from like 70 to 60 or 80 to 70, just by exercising for 6 months.
Right.
And then you have, years after that.
Well, I do enjoy the technology that you can monitor your heart rate and monitor certain physiological things that are taking place. And my resting heart rate is typically about 52. Right. So I think that's a really good resting heart rate. But seeing that feedback has allowed me to kind of focus in on what I'm doing and making my training more effective. So that I'm not just.
And there's a point of getting, of too much training.
Sure.
Where it goes too low and then you get symptoms. So there is, we see that in marathon runners when they're very aggressive.
It's like stretching. You can be too flexible. You can be too trained for the heart. There's, as you've probably said a long time, moderation is kind of the key to everything. As long as you stay reasonable, then you'll get a benefit, but not go over the line. So.
Right. Don't injure yourself. Right. Don't damage. Don't make it worse.
Dr. A.
Okay.
Thank you very much for your time.
Thank you very much.
He's so good.